Hello, this is Ryan. We're going to go over how to complete a PT discharge visit and a PT discharge summary. The PT summary is included both with the billable PT discharge, and that will be the portion you complete when you complete a non-billable discharge visit. So let's get started. The patient identity will need to be confirmed, 40 minutes minimum. The medical and PT diagnosis, this information carries over from previous visits, so you will not need to manually input that. Homebound status, yes, as this is a billable visit. You'll need to check one of these boxes. Vital signs need to be filled out in full. You need to complete prior. If you complete post, that's fantastic. You will need to address the patient's pain here. The range of motion and strength. Ideally with this, you show progress. If the patient was a 3 out of 5 with initial evaluation, did they progress? Are they now a 5 of 5? You will need to address the functional assessment. Is the patient now independent? Did they show progress compared to the initial evaluation? You will also need to select test and measures and complete one standardized test. Hopefully this shows progress towards goals. Your evaluation and testing description needs to be filled out here. This cannot be left blank. Your treatment, what did you perform this visit, needs to be completed here. And there will be a blue box right here that says update goals and interventions. We go over that in a separate video, but you will need to address the goals. Were they met? Were they not met? By clicking this. And then you will need to kind of give a broad explanation on goals. Were all goals met? Were goals partially met? If partially met, give a brief description here. Ambulation distance goal not met, balance goals not met, or simply goals met. Discharge disposition, where are they discharging to? Are they discharging to home, to outpatient, to home exercise program? That is the PT discharge, and then on to the discharge summary. This is the discharge summary. So the discharge summary you complete with a billable discharge, and this is the portion also you will complete if you ever have to do a non-billable discharge visit. So date completed, discharge date, those are the same dates. Reason for discharge, goals met, maximum level of function achieved, patient family request. Every once in a while you'll need to add no further insurance authorization to the other. If the agency comes back and says, I'm sorry, no more visits are allocated, then that will be the reason for discharge. Condition at discharge, independent. What do they require? Some of this information you can copy and paste from the page prior to. So services provided, check what clinicians they had coming. Is this patient a candidate for outpatient? Yes, no. Usually orthopedic patients will be candidates. Goal summary outcome. So usually I check a couple of these. They improved functional status, condition improved, goals met. Broad explanation, similar to the previous page, goals met. You do not need to address this. This will usually not be here. Discharge information. So you definitely need to provide discharge information always to the patient. If these are no, that's probably not a good thing. So discharge instructions provided to the patient, check. Patient, check. If you gave instructions to the caregiver, check. Did they understand the discharge instructions? If the patient doesn't understand, we probably need to select caregiver. Did you let the agency know? Did you talk with a nurse? You'll need to address these appropriately. Information provided. If we did not provide a home exercise program, we're probably not doing our job. So information provided, we always need something here. Home exercise program at a minimum. Resources ongoing. If there is none, select NA, because none is not an option. And typically they may have things that we don't know about. So none. Living arrangements during discharge. This patient was discharged at home setting, so home. Care coordination. You need to coordinate some type of coordination here. I didn't check discharge from home health services because this patient may have ongoing services. They may have PT, they may have speech, they may have nursing. So I did not include this. I just selected physician notified, scheduler notified. And that is how you complete a discharge visit. If you have any questions, please feel free to message us. Thank you for your time.